Hi everyone, I'm Ray and this is Bupa's Movement as Medicine series. Today we're focusing on sciatica. So you can do this session daily, but please note this is for mild to moderate pain. If your pain is severe or if you're unsure for any reason as to whether you should be doing this session, please check with a medical professional first. If you have a loop resistance band for this session, that would be great, but I can give you alternatives if not. Other than that, a mat or a carpet underneath you would be great as we're doing some floor work today. Let's get started. Okay guys, so we're going to start with some stretches that can provide some instant relief. So we're going to start with a cat-cow. So we're starting in a tabletop position like so. If you've got bad knees, hold fire because I'll show you a different version to this in a second. So we're doing our cat and we're doing our cow. Okay, so we're arching our back all the way up to the top and then arching down. So we're going to do about a minute on this one, guys. Gently mobilising the spine, warming up all the muscles around our lower back and hips. Okay, so carry on with that one if that's the one for you. If not, come to the chair. You're gonna have your hands on your knees. We're gonna arch our lower back towards the back of the chair and then arch it away from the chair. So curving over and arching back. Okay, so if you've got bad knees, this one can be the one for you. Okay, one more. Lovely. Okay, coming down onto our backs then, we're going to bring one knee into the chest and pull that in. So this one can relieve some pressure on that sciatic nerve there. We're going to hold it for about 30 seconds on each side. If it doesn't feel quite good after, it's like 10-20 seconds, feel free to release and you can come back to it. You can do like a few little 5 or little 10-second ones. You don't have to hold it for the full 30, but you can do if that feels good, okay? So just squeezing that chest, squeezing that knee towards the chest. It should get a nice stretch down the lower back there. Keep holding that one. Nice deep breaths. If one leg also doesn't feel good, you can do this. Just double leg like so. So a few different versions there for you. Okay, next up, we're going to bring one ankle over to the other knee and we're going to bring our hands through the gap and around the other leg. So if you've got your left leg over your right leg, you're going to grab your right leg and pull it towards you. So you can just do this if you've just got one side that's affected. You can just do this on the side that's affected. So my left leg here, the one that's crossed over, this is the one that we're stretching. So this is to stretch our piriformis muscle in here that can sometimes compress the sciatic nerve, which can contribute to our pain, contribute to our symptoms. I'm just going to swap sides here. So you can just do both sides while you're here, but I guess if you're short on time, you can just do the side that's affected. And again, that would be the leg that's crossed over. That is the side that you're going to feel the stretch there. So just pulling that other leg towards you until you feel a stretch down the side of your bum on the crossed over leg there. Okay. And releasing that one. Going to come down to the floor again. Again, if you've got bad knees, I'm going to show you an alternative in a second. So knees come nice and wide. We're sinking back onto our heels and reaching our hands forward and really relaxing the hips back into the heels. This is a really nice one for the lower back and the muscles around the hips, just stretching them out there. So relaxing into it. I'm going to show you the chair version. So sitting down in the chair, again, knees nice and wide, and we're simply going to fold ourselves all the way forwards so we feel a bit of a stretch down there and our hips feel like they're getting stretched out as well. Okay, so just holding that there, nice and relaxed. Nice deep breath, relaxing right into it. Okay, we're coming into a hamstring stretch now. So if you've got a loop resistance band, or you can grab a towel or a bit of rope or whatever you've got, you're going to be putting that around your calf here, flexing the foot towards you. The other leg relaxes down and we're just going to pull this leg towards us. Don't worry if your leg is more like here and you feel a stretch down the back. That's absolutely fine. You're just coming up to the point where you can feel a stretch down the back of your hamstrings, okay? So just holding that one there. Try not to let your hip come off the floor. So the aim isn't to get as high as possible. The aim is to keep your hip on the floor and be able to feel that stretch a little bit more by keeping that hip down, so we're not trying to cheat it a little bit. You're going to change sides after about 30 seconds, so looping your towel or band or rope, whatever, keeping your hip down and bringing that leg towards you until you feel stretched down the back. Tight hamstrings can pull on our pelvis and your lower back, which can increase that stress on the sciatic nerve there, and releasing that one. Okay, so we're going to look at some strength exercises next for prevention of pain longer term. So I'm going to look at some core exercises to start with. So we're looking at some dead bugs, just our legs only today. So we're tucking the pelvis under, so kind of scooping the pelvis and bracing all the way across the front here before we then raise the legs to about 90 degrees. So watching that our pelvis doesn't then tip as we come up. Okay, so really tucking and engaging across here. If this is enough for you, and we're going to hold this for a minute, that's great. If you're feeling this a lot over here and you're feeling like a little bit trembly, a little bit shaky, like haven't put a lot of effort in, that's absolutely fine. If this is, if you've held this for a minute in previous times you've done this session and it's feeling a bit easy, you can start to tap one leg and then the other leg, just watching that when you bring the leg down, your pelvis doesn't then release. So bracing all the way across here. And then after that, you can start bringing your legs down and hovering. Okay, lovely. Moving on to bird dogs, coming onto our knees like so. Again, we're making sure that we're not arching the back, so tucking, bracing across here. And to start with, you're going to lift your opposite hand and opposite leg and just see if you can hover 30 seconds each side. Okay, if you've done that before and you find that's quite easy, you can hover and just move out slightly. We're looking to not let the hip kind of rotate or drop as we're doing it. So we're looking to keep this midsection exactly where it is. If that's starting to feel a little bit easier, you can lift and then go a little bit further. Okay, but if you're going a bit further and you feel that your pelvis is then tilting, we've gone too far, so just come in a little bit there and don't come out quite as far. So you should be feeling this all the way across here. Okay, so these are really good core exercises to support the lumbar spine and reduce some nerve irritation there. I'm going to move on to some glute bridges. So working the glutes a little bit more. The stronger our glutes are, the less the piriformis has to work, which can increase that sciatic nerve irritation. So heels planted, pushing through the heels, tucking again and squeezing up with the glutes. So we're not looking to just push the glutes, like push ourselves up like this, looking to do that tuck up to the top, really engage the glutes here. Okay, so power up, squeeze and hold, slowly down. We're going to go for about a minute on these. If this again is a little bit easy now and you feel like, yeah, I'm getting good glute engagement and I need a little bit more of a challenge, you can whack a glute band or a loop resistance band, around above your knees here. So having a little bit of tension out against the band again as we're powering up, and so you come down. As soon as your bum touches the floor, we're powering up again. So we're trying to keep glute engagement all the time during this exercise and get them burning as much as possible. So the only reason our hips are coming up is because our glutes are tucking and squeezing to the top. I'm going to show you one last version of this. If that's getting a little bit easy, we can do single legs. So just show you one leg today. And again, we're not looking to come all the way up like this. I'm not really using my glutes there. We're looking to tuck slowly down, tuck slowly down, and then you can switch legs. Okay, this leg can do whatever you fancy. All right, banded walks. So you're going to put the band, if you have it, over your knees. If you don't have it, you don't need to use a band for this one. We can still get some nice glute engagement. So we're working the side glutes here. Okay, so we start about hip distance apart and we're sending the hips back. So start with, it looks like this. We're not arching, we're sending the hips back, and we're going to step and bring that other leg in. So we're leading with that leg and stepping in. Lead and step in. So you should be feeling this down the leading side, down the side of the glute there. If you're not, try and really sink into it until you feel a bit of glute engagement there. Okay, come back the other way, squeeze and return. Squeeze this side and return, sinking in to the side of your glutes there. One more. Okay, it's about 30 seconds on each side. Try and get a good burn there. Again, you can pause and repeat this exercise if you want to get a bit more of a burn. Okay, moving on to clams. So we're working the external rotation of the hips of this one, similar to our banded walks. We've got 6 muscles as well as the piriformis that externally rotate the hip, and so we're not loading the piriformis too much to then irritate the sciatic nerve. We want to work these muscles. So for our clams, we want to make sure this top hip is stacked on top of the bottom hip here. We're then lifting the knee and coming down. We want to make sure that we're not pressing our feet together at the bottom, and if we're coming all the way up like this, firstly, our hips are going to be rocking all the way back, and we're not isolating those muscles in the side of the hip. So hips stay stacked one on top of each other, bracing across the core, and we're lifting that knee slightly till we feel a bit of a squeeze inside of our bum here. So nice and slowly up, squeeze, and slowly down. Again, if you're not feeling it here, you can always rewind, watch what I've just said again about keeping the hips on top of each other, just lifting the knee ever so slightly, and just keep practicing it until you feel a bit of a squeeze inside the glutes here. So squeeze up, hold, and slowly down. About 30 seconds on one side and 30 seconds on the other. So knees stacked on top of each other, bring the hips so they're level on top of each other, light touch with the feet, not pressing down on the feet, lifting the knees slightly until you get a squeeze in the side of your glutes there. Last few. 1, 2, and 3. Awesome. So as I say, you can do this daily, and please check out the rest of our Movement as Medicine series for other conditions.